Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's January 16th, and my guest this week is Victoria Reese. Victoria is the founder of the We Are Illmatic campaign, and we'll be talking with Victoria about what being Illmatic is all about in just a few minutes. If you've listened to the podcast before, then you already know that I believe everyone living with MS in their lives, and that includes patients, caregivers, family members, and even friends, can be and should be an MS activist. We should be among the first to speak up when our legislators are considering passing laws that will have a direct impact on our health and well-being. And when we speak in one voice, we can make a difference. Last spring, I participated in the National MS Society's Day on the Hill, when an army of MS activists from all across the United States visited with their congressional representatives to help them better understand how some of the pending legislative issues could impact people living with MS. And one of the things that we asked our lawmakers to support was continued funding for the congressionally directed medical research program. Now, this program is located within the Department of Defense, and one part of the program is something called the MS Research Program. And since its creation in 2009, the MS Research Program has funded more than $40 million in MS research. And just in case you're curious, the reason that the MS Research Program falls under the Department of Defense is because there are a large number of military veterans who are living with MS, and the percentage of military veterans living with MS continues to grow. Today, more than 23,000 veterans are being treated for multiple sclerosis by the Veterans Health Administration. So this is an important research program that directly impacts people, whether they be veterans or not, who are living with MS. And this past December, the President signed the National Defense Authorization Act, which is the law that allows the MS Research Program to continue. This year, the program will receive an additional $6 million to fund MS research. So congratulations to all of the MS activists whose participation helped to pass this bill into law and fund important research. You know, there are so many things that seem beyond your control when you're living with multiple sclerosis, but choosing to participate, choosing to add your voice to the conversation about policies that can directly affect your quality of life, your health, and your well-being, that's all within our control. So I know you've heard me say it before, and I know you'll be hearing me say it again. Please get involved in advocating for a better world for people and families living with MS. There are so many ways to participate without ever having to even leave home. You can visit the National MS Society's website, click on Get Involved at the top of their homepage, and do exactly that. Get involved. And as you're upping your game and joining the army of MS activists, there are some other things you should know about. While we're on the subject of good legislative news for the MS community, last week, Congress passed the bipartisan RAISE Caregivers Act. Now, RAISE is an acronym for Recognize, Assist, Include, Support, and Engage. And the RAISE Caregivers Act requires the Secretary of Health and Human Services to develop, maintain, and update an integrated strategy to support family caregivers. The goals of this strategy include identifying actions that government, communities, health providers, employers, and others can take to support family caregivers. Some of these actions include promoting greater adoption of person-centered care and family-centered care in health settings and long-term care settings, training for family caregivers, respite options for family caregivers, ways to increase financial security for family caregivers, workplace policies to help family caregivers keep working, collecting and sharing of information about innovative family caregiving models, assessing federal programs around family caregiving, and addressing the disparities and meeting the needs of the caregiving population. This law also directs the Secretary of Health and Human Services to convene a Family Caregiving Advisory Council to advise it on achieving those goals, and gives the Department of Health and Human Services 18 months to put this all together and then report back to Congress on the progress that it's made. This is a pretty major legislative victory. The Raise Family Caregivers Act is the very first official step that our country has taken to really acknowledge and underscore the value and the importance of family caregivers. It's going to produce specific actions that communities, organizations, and individuals can take to recognize and support family caregivers, but simply validating the idea that we need to include family caregivers in our national public policy is huge. I talked about the Raise Caregivers Act when it was passed in the Senate back in October, and I invited everyone listening to the podcast to call their congressional representatives and ask for their support. Well, now those representatives in the House have passed the bill. It's on its way to the White House to be signed into law. And for those of you who stepped up and added your voice to the conversation, thank you. Thank you from the 40,000 family caregivers in the United States who sacrifice so much every day to care for their loved ones. There's good news for people in Europe who are living with progressive multiple sclerosis. Last week, the European Union approved Ocrevus for the treatment of primary progressive MS and relapsing remitting MS. Now, Ocrevus is the first drug therapy that's been approved for treating primary progressive multiple sclerosis. It was approved in the United States last March and is projected to reach more than $1 billion in sales in just its first year. Ocrevus is administered to MS patients every 6 months, and the cost in the United States for this treatment is approximately $65,000 a year. There may be a way to track the worsening of some MS symptoms, and it may be as easy as writing your name. A small study indicates that the deterioration in MS patients' handwriting aligns with declines in their movement, sensory, and cognitive skills. Multiple sclerosis can cause a loss of dexterity and finger movement control, and both of these fine motor skills are used in our handwriting. So in this study, researchers recruited 19 MS patients and 22 healthy patients who were the same age as the MS patients. Each group was asked to write a sentence on a digitized tablet. And it turned out that the MS patients took a lot longer to write each word and to manage the spacing between words in the sentence, so they ended up taking much longer to write the sentence than the healthy control group. Further analysis of the handwriting indicated that the MS patient's writing wasn't as smooth as the healthy group, and researchers found a correlation between the MS patient's movement and cognitive status on the one hand and their handwriting on the other. So these findings can be particularly useful in planning effective rehabilitation activities for MS patients. Measuring the gray matter in an MS patient's brain has become increasingly important, as researchers have shown that gray matter atrophy may precede the onset of MS symptoms and even predict some clinical disabilities. And researchers at Boston's Brigham and Women's Hospital have just published the results of their 2-year study, which suggests that treatment with Gilenya may actually limit cerebral gray matter atrophy in patients with relapsing remitting multiple sclerosis. The study found that Gilenya also had a positive effect on MS-related brain lesions. The University of Southern California is looking for Hispanics and Latinos who have been diagnosed with MS within the last 2 years to participate in a clinical trial on genetic ancestry, acculturation, and disability in Hispanics with MS. Investigators are actively recruiting 400 participants and will examine the impact of genetics and cultural perceptions on disease severity. To get involved in the study, participants will have to visit one of the study sites. Participation involves answering questionnaires about acculturation and perception about their own condition, watching a short film about MS, and providing a blood sample that will be analyzed for ancestry. The researchers will assess whether Asian, Native American, European, or African genetic markers in the DNA influence MS disease severity. And the participants in the study are going to be followed for 2 years. If you've been listening to the podcast for a while, you might remember that we had the principal investigator of this study, Dr. Liliana Amezcua, on as a guest, and she gave us some background into how cultural perceptions can end up impacting multiple sclerosis disability. If you missed my conversation with Dr. Amezcua, you can go to wherever you find the RealTalk MS podcast, iTunes, Apple Podcasts, Google Music Play, or the RealTalk MS website at realtalkms.com, and just replay episode 3 and you'll hear it firsthand. And if you think you might be interested in participating in this study, please contact Andrea Martinez at the Keck School of Medicine of the University of Southern California, and you can reach her at area code 323-442-6817, and she will connect you to the nearest site for this study. My guest today is Victoria Reese. Victoria is an MS ambassador on behalf of the National MS Society, and she's the founder of the We Are Illmatic campaign. Welcome to the podcast, Victoria. Thanks for joining me today.
Hi, thank you for having me.
So I want to get into what the We Are Illmatic campaign is all about, but first, I know you were diagnosed with MS in 2012. Can you kind of take us through how you got to the point where you knew you needed to launch that campaign?
Okay. So unfortunately, I was diagnosed in September 2012. The journey has been short but long at the same time. Like, I got diagnosed, I really didn't know what multiple sclerosis was when I got diagnosed, and it really took me a long time to learn about it, search it. It took me a long time emotionally to be able to accept that that's what I had and the things that I would be dealing with or potentially dealing with the diagnosis. During that time that I was trying to learn and ease into the MS community, I started going to MS walks out here in Los Angeles. And I would go with my friends, and I really just didn't see that many people of color. I also, when I would research MS, I wouldn't see images of people of color. And sometimes even on websites, they'll talk about MS, but then they'll break it down by race. And there wouldn't be much information or much studies on African Americans. So it just really, it bothered me that I knew that it had to be other people out there that were African American that had MS, but I wasn't seeing them. So I went to support groups, I've done things like that, and I just really saw a void there. So I was very transparent on social media about having MS. And when I did that, people started coming out of the woodworks, introducing me to, and I didn't say I've never met another Black person that has MS, but people just want me to meet their cousin who had MS or their daughter or their sister. So in that transparency on social media, I started to meet other people that were African American with MS, and they would say the exact same thing as me. You're the first Black girl I've seen with MS, or I've never met another person with MS, a Black person with MS. So I really saw the void. So that kind of led me to starting We Are Illmatic, because I understand that the MS Society and other organizations that support the MS community, they do the best that they can. But I think that it also takes people to meet them halfway. And perhaps people in the Black community don't reach out for resources like that. So I kind of wanted to bridge that gap. And here we are.
So let's talk about the first question. When you look at the campaign, is talk a little bit about how you came up with the name.
Okay. Well, so Illmatic is the debut album of legendary rapper Nas. It came out in 1994, and I always tell the story and with a smile on my face because it's just so silly but very fun to me. Though the term Illmatic is, from his definition, is supreme and ill, but ill in the good way. Ill is sick in the good way. That is a term in our culture that we use. I guess I would say in the hip hop and urban community that we use to say something is good. The outfit is sick. The outfit is ill. And all this time, I never, when I would hear the album Illmatic, when I would hear that name, I never thought ill as in sick. I never thought sick. And that shows you how easily we can separate words when we use it out of context. So I never use it that way. But one day, I think he posted about it, and I was like, wow, Illmatic. Like, I could really do something with that word because I'm Illmatic. I am Illmatic in the way that he means it, but I'm also ill and I'm sick, but I'm still very cool. I'm great. I'm great, and I'm strong, and I'm powerful. And I really thought this would be a great word to use as an empowering word for women that have MS, because we are sick, but we are still ill. In any way you want to put it, we are all of those things. And I just kind of wanted to take away some of the shame in being sick. I have a lot of women that have talked to me in confidence that have not told their parents, have not told their significant others, have not told their friends, have not talked to anyone about it, and they're just dealing with it alone. And a part of it is because of the shame that comes with it. They are not ready to deal with how people treat them after, or if someone like their significant other would want to still be with them. And I totally understand the fear in that. But this is a hard enough illness to deal with without adding shame to it. It's just horrible. And I just really wanted to be like a beacon of light for those people, and to be a leader and say, hey, yes, we're sick, but you can still live a full, beautiful, happy life. There's people that have MS that didn't think they would have kids, but they have beautiful children, beautiful, healthy children. And I just don't want us in the MS community to feel so limited. And I think that happens a lot. So I hope this campaign helps. And it's been so great and so supportive to talk to women of color. And for me, myself, I wanted to meet women of color that were older. Like, what does it look like to be 40 or 60 with MS, and you've had it for a while? What does that look like? I wanted to potentially be able to see myself in them. And every day I get to be in a support group with women that look like me, that are dealing with the same things I'm dealing with. And I'm able to ask them questions on what they do. So it's great.
So the Illmatic campaign itself, it sounds like it's kind of a combination of something to raise awareness and also provide a virtual support system.
Obviously, we have different races that are affected by multiple sclerosis, but we have different faces to it. We all look different. Some people are mobile, some people are immobile. And some of us suffer from, some symptoms, some of us don't. So there's just so many, we're a multifaceted community. And I think that even within the MS community, there could be some, some division. There, people who may be in a wheelchair may not all the way relate or feel that they can relate to someone who's not in a wheelchair, and vice versa. So at the end of the day, we all have the same illness. And I really wanted to just bring us all together, because we are a community. We can help each other. We can educate each other, and we can use each other for support, which is so very needed. No one understands what having MS is like, besides people that have it. One may have a more severe case than the other, but we are each other's keepers. We understand each other, and it's just important for us to put different faces to it, so that when we are doing research, that a person like me comes up, a person like, my friend who may be in a wheelchair comes up, or my friend who has a cane comes up, my friend who is Hispanic comes up. I just think it's very important to be able to identify with people so that you can understand it. And maybe, like we mentioned earlier, maybe the African Americans that get diagnosed potentially wanted to or tried to be a little more active or involved in communities like that, but didn't see themselves on the website or didn't see themselves at a walk and felt like, this isn't for me. This conversation, these tips aren't for me, so I'm just going to stay at home. I'm not going to be involved. And that could potentially be a problem. We won't know until we try. We won't know until we have some inclusion.
I had the opportunity to interview a researcher at USC who's actually doing a really interesting study that she's rolling out now, dealing with the impact of culture in the Hispanic American community in terms of people coming forward with their illness, whatever it might be. She happens to be an MS researcher, so she's looking at that. But what she's found is that when you go into some communities, there are actual cultural barriers that are keeping people, simply because of the way they've been raised or the way they've observed other family members or friends act and behave, that you don't talk about it when you get sick. So this is kind of a big step that you're taking.
Culturally, I think that African Americans, we are not the most forefront about illnesses. We are not, confident or interested in going to an MS walk. Just culturally, we would pray about it. We would go to church. We would deal with our families and work with our doctors. But anything else, I think that's just not how we are as a culture. It's just, I do believe culturally it's like that. I'm not sure what it stems from.
I can't tell you how glad I am to hear that you're providing, first you're illustrating it, and you're certainly stepping forward with your own story, but you're also providing a mechanism for other people to kind of get it, to kind of see that there's another way to look at this, and why sometimes getting support can really be helpful when you're dealing with a chronic illness. There's a lot of people listening to this, and I know some of them are thinking right now, how can I connect? So how can they connect to the Illmatic campaign?
Well, we have a website, is weareillmatic.com. There is a hub of information. You can read articles that we've been featured in. You can find our private Facebook group and request access if you are a woman of color that has been diagnosed with MS. You can find out more information of how we started and the different content that we're creating and putting out on YouTube and on social media, which is just honestly just storytelling. We're allowing women to tell their story. We are giving tips and resources. We have a lot more coming. We even have merchandise that you can purchase to support it in your own city or wherever you feel like it. So that website is where you can find out more information. And myself, I'm on Instagram. My name is Picture This Vic, and I'm also that hub of information where you can get to anything.
I want to thank you again for taking the time to chat with us, Victoria Reese. You are Illmatic.
Thank you.
That is going to wrap up this week's Real Talk MS podcast. If you haven't already, let me invite you to subscribe to the podcast so you never miss one of our episodes. You can find us on Apple iTunes, Apple Podcasts, Google Music Play, Stitcher. And as of this week, I am very excited to let you know that you can find the Real Talk MS podcast on Spotify, so it is easier than ever to follow us, and I hope you do so. My name is John Strum. Thanks again for listening, and we'll catch you next time.